Thank you, Jeremy, for your kind introductions, and thank you for the organizing committee for having me in these sessions. And as Jeremy said, I would like to present the finding from the SEATrans cohort. I have no conflict of interest to declare. And this is the outline for my presentations. For introduction, transgender people are at high risk of HIV, mental health problems, and other health issues due to a combination of biomedical factor, behavioral risk, stigma, discrimination, and social factor. Community-led services have played a key role in improving access to care, the retention, and the health outcome of transgender. However, there is a lack of region-specific data on transgender health, especially on the mental health and the structural factor. So SEATrans was established to assess the overall health among transgender people in the regions. Now I would like to share a quick overview of the SEATrans. The SEATrans stands for the Southeast Asian Transgender Health Cohort, which is the first observational multi-country transgender-specific cohort in Asia. We enroll 450 transgender and non-binary participants from Thailand, Philippines, and Vietnam. We collect data on many aspects of transgender health, physical health, mental health, behavioral, and well-being. And the study site will include the transgender-friendly community-led clinic, including the Rainbow Sky Associations of Thailand, Tanzania Clinic in Bangkok, Thailand, Victoria by Love Yourself in Manila, Philippines, and Jilin Clinic in Ho Chi Minh City in Vietnam. So for the objective, this analysis was a part of the SEATrans study and had two main objectives. First, to characterize the burdens of HIV, mental health problems, substance use, and lifetime exposure to the stigma, discrimination, violence, and other factors among transgender people in Southeast Asia. And second, to assess the association between these factors and mental health outcomes in these populations in the region. For the method, transgender and non-binary individuals aged 18 years or older were enrolled between December 2022 until January 2025 to the community-led clinic that I mentioned before. As baseline and every 6 months, we collect the key data in the following area. For the physical health, we assess the HIV, STI screening, hormone level, and metabolic profile like kidney functions, lipid profile. The mental health, we screen using cell-administered validated tool. For depression, we use PHQ-9, anxiety using GAT7, and post-traumatic stress disorder using PCR5. And participants also complete the self-administered questionnaire on the behavioral list on the experiencing of stigma, discriminations, and violence. Now I would like to share the baseline characteristics of the SEATrans cohort. Of all participants, most identify as transgender women, about 92%, and about 7% identify as transgender men, and less than 1% as non-binary. In terms of the nationality, most participants were from Thailand, followed by the Philippines and Vietnam. And you can see on the right-hand side, the median age was 28 years. About 33% were living with HIV, 9% report substance use, and 16% had engaged in sex work. For the mental health, 23% screened positive for moderate to severe depression, moderate to severe anxiety, and probable PTSD. And 23% of participants report experiencing stigma. About 83% had faced the discriminations, and 27% report violence, including physical or sexual violence or psychosocial abuse. Here I would like to show how various factors were associated with mental health problems among SEATrans participants. As I mentioned in previous slide, mental health problem in this analysis are defined as a participant who screen positive for moderate to severe depression, moderate or higher anxiety or probable PTSD based on their self-administered. And you can see from the left to the right, stigma was experienced by 29% of participants with mental health problems compared to 61% of those without. Discrimination was reported by 93% of those with mental health problems compared to 80% without, and 49% of those with mental health problems had experienced violence compared to 20% of those without. We also found the age-related patterns among younger participants at group of age 18 to 24. 42% had mental health problems compared to 30% of those without. There was no significant association between mental health problems and HIV status or substance use in this analysis. These findings highlight that stigma, discrimination, violence, and younger age are significantly linked to mental health challenge in these populations. For the conclusions, transgender people in our cohort had high rates of risk behavioral, high severe prevalent mental health issues, substance use, stigma, discrimination, and violations. Mental health challenges were associated with lifetime experience of stigma, discriminations, violations, and the younger age. Our findings highlight the urgent needs of integrated transgender-specific health intervention that address not only the physical concern, but also mental health and also respond to the stigma discriminations. To the next step, there are some limitations on this analysis, so key steps are needing for moving forward. First, these findings are delivered from cross-sectional data, so further longitudinal and qualitative research is needed to better understand the complex interplay of these factors and the mental health outcome. Second, our mental health data was based on screening tools that from the clinical diagnosis. So, for deeper insight, the clinical diagnosis from the expertise is necessary. And lastly, expert research should inform sustainable, inclusive transgender health services. And these steps are essential for translating evidence into effective, equitable health interventions. And I would like to sincerely thank all the transgender participants, and thank you to the TED Asia who support this study, and big thank to the community partner that sit here to be our partner, and as well as the entire SEATrans study team. And thank you for your attention.